Yeah, I can hear you.
Okay, perfect. There we go. Hi, welcome everyone. So glad to have you here for this really important conversation on women's homelessness and COVID-19 in Canada. I'm guessing there's a lot of folks on the call who are kind of at the end of your day. I'm so glad you're here with us. I have a cup of tea and water and a glass of wine for later. So really settling in, hope you are too. Before we get started, I thought it would be helpful to kind of go over some of the basic tech stuff and introduce this important topic. Leah Gazan connected with ourselves. There she is. Yeah. Leah, I think you're muted.
Oh, I don't have a mute on.
No, you're good. You're great. You're great.
Ready?
Yeah, I'm going to have all the speakers introduce themselves, but we really wanted to have this important conversation about thinking about how does COVID-19 really manifest in the lives of women and girls and gender diverse folks who are experiencing housing precarity, who are homeless, who are experiencing, multiple forms of marginalization in Canada. And what are we imagining for a post-pandemic world where there are opportunities for a really exciting transformation of our housing system, of our justice system. So we have some brilliant folks here today. On the tech side, I should say, feel free to use the chat box if you want to introduce yourself, say hi, add a comment. We have kind of a robust schedule today, so I'm not sure how much we're going to get to your questions, but feel free to pose them. Maybe this is something we would do again and invite others to come and join in a further conversation. I think that is it. I think we're pretty set up for any tech issues that arise, but let us know if you're having any problems and we'll see what we can do. And perhaps I'll pass it on to Leah first to introduce yourself and tell us a little bit about what brought you to the work that you're doing on women's homelessness and women's rights, and just kick us off.
Bonjour, Heyushka Washtewi, Red Sky Woman Indigenous, Makwa Dodem, Wood Mountain Lakota Nation, Treaty 4 Territory, Saskatchewan. And I'm currently living in Winnipeg, and I'm the new member of parliament for a place called Winnipeg Centre, a riding that I love. So I've been a longtime advocate around human rights matters. Certainly in the riding that I'm representing right now, we are the third poorest riding in the country. The glaring human rights violation of homelessness in our city is undeniable. You see it everywhere in the city of Winnipeg. And particularly for Winnipeg in regards to women and girls. We are one of the only urban centers at this point without a 24/7 safe space. This is something that I've been really advocating hard for. We deserve safe places to go. And, it's time that, we just get on with it and ensure people's human rights are realized and that everybody has affordable, adequate, accessible housing. We have the resources. We just need the political will now. Thanks.
Beautiful. Thank you, Leah. Anjum, maybe I'll have you jump in and tell us about yourself and the work you do.
Absolutely. So first of all, thank you so much for creating this space to have this dialogue, because I don't think we talk enough about the gendered implications of this pandemic, especially as it impacts housing and homelessness in this country. A bit about myself. My name is Anjum Sultana. I'm the National Director of Public Policy and Strategic Communications at YWCA Canada, which is the nation's largest and oldest organization focused on gender equity issues. This year actually is our 150th anniversary. So we've been working on housing actually for a very long time across the country, and it's changed over the generations around how we were serving and supporting our clients and supporting our community members. We work in 300 communities across the country, and we offer 34 shelters in particular, and all types of shelters, both violence against women shelters, as well as shelters for people who require emergency shelters, second stage, etc. And we also provide affordable housing units. And so for us, when we think about the work that we do, we're interested in providing services and programs, yes, but we're also interested in addressing the root causes that are creating conditions of homelessness, that are creating conditions of income insecurity, that are creating conditions of gender-based violence. For us, we can't do our work if we don't address the root causes. And something else I'd like to share, when we look at the work that we do, we take a very deliberate intersectional approach, looking at the experiences of Indigenous, Black, and racialized women, people with disabilities, migrant communities. And we're seeing actually across the country, it doesn't matter which part of the country we go to, one of the top issues people always talk to us about is housing and homelessness. And so that's why we do this work. And across the country, actually, before this pandemic, we were seeing a lot of issues that right now are actually heightened. And I'll talk a bit more about that as we go on. But just to say that in many ways, this pandemic is part of many pandemics that are happening and many crises that are happening across the country. And so we can't ignore those elements as well, in addition to COVID-19. So I'll leave it there for now.
Thank you so much, Anjum. Such a pleasure to have you here. And Leilani, we'd love to hear from you.
Sure. Sorry, I've lost my Zoom app. There we go. I don't know what happened there. First of all, thank you so much, Leah, for contacting me and spearheading this initiative. Super important conversation. I feel I'm in such good company with you, Leah, and with Anjum. You're so articulate, both of you. You pulled no punches. Straightforward talk, which is how I like things to roll. So just a huge thanks. This is an important conversation. I'm Leilani. I am the former UN Special Rapporteur on the right to housing. I just finished my 6-year term last week. I survived. I am now the global director of an entity called The Shift. The aim of The Shift is to secure the right to housing for everyone, everywhere. So it has a big mandate, global reach, a worldwide movement, and I'm super excited to take up the post in a full-time way. I have a super long history working on the right to housing, but particularly the right to housing for women. It's in fact how I first engaged all this stuff, particularly at the international level, and then eventually domestically in Canada, and then back out in the international world again. When I first started to get interested in the right to housing, like housing as a human right, way back in the 90s, it was actually quite a new idea back then. And I engaged the international world on the issue. And I noticed there were a lot of men kicking around talking about the right to housing, and they were defining it and going off to UN committees and getting all this stuff, all these standards set on, you know, what does adequate housing require, and all this stuff was being generated. And I'm like, wait a second, where are the women? And where's the feminist analysis? Where's the women's human rights analysis? So I was quite young. I was fairly gutsy, I suppose, in my 20s and early 30s. And I decided that I needed to do something about that. And in what we called back then, I needed to engender the right to housing at the international level. So I spent many years, like 5 years with my head down, talking to women, trying to understand the relationship between women and the human right to housing, and what that would look like, what that means, what does that mean in terms of law, how can we reinterpret law so that it's responsive to women's actual experiences, rather than law being responsive to a perception of women's experiences and a male perception of women's experiences. Anyway, I trod a really interesting path, and I ended up coming back to Canada, and I worked a lot on women homelessness and women and housing equality, which is what we called it back then. I started one of the first, I think it was the first national working group on women and housing. in Canada. We disbanded when Harper got elected. Well, we were defunded. But nevertheless, I come to this deeply committed. All of my work as rapporteur has been inclusive of women's experiences. Everything I've done, always will, everything I do, everything I will do, really informed through a women's human rights analysis and feminist analysis.
Amazing. Thank you so much, Leilani. And we have all benefited from you continuing to be so gutsy in so many ways. And we're so glad to have you.
I echo that, Leilani, and like, congratulations on 6 years. And certainly thank you for, thanking me for inviting you. But the reason I did is because I was reading your posts on Twitter and I said, I have to speak to her.
And here we are.
The real I like this lady. So congratulations on 6 years.
Thank you.
That's lovely. And yes, my name's Kaitlin Schwan. Really, really ecstatic to be here. I've been working in the area of homelessness for a long time in various capacities, but I guess I'm kind of bringing the nerd factor here to the panel. I'm a researcher. I work with Leilani Farha as Director of Research for The Shift, and was really honored to work with her on the UN Special Rapporteur to the Right to Housing. And I also work at the Canadian Observatory on Homelessness. So spending a long time thinking about what role does research have to play in terms of driving housing equity and justice for all folks, but certainly for women identified folks. And what, I was thinking about this panel today and really wanted to start with, what are the unique challenges when we bring a gendered lens to COVID? What are the unique challenges for women who are experiencing housing precarity, who are homeless? And I thought a place to start actually might be to give us a little bit of a sense of data and where we're at in the women's homelessness system in Canada. So I'm going to try to share my screen here and just share a couple of statistics with you folks to get us started. And let's see if I can do it. There we are. Okay. Perfect.
Yeah, we can see it. Yeah.
Got it? Okay, yeah. Awesome. So I've been doing some research. I should say I'm from the Women's National Housing and Homelessness Network.
Oops.
That's the capacity with which I'm here, which is a large network from across Canada that's focused on preventing and ending women's homelessness. Huge priority for us is really amplifying the voices of folks with lived expertise, and I have such an honor to work side by side with so many of those folks. And so excited to share about the network today. And as part of that work, we are developing kind of a national portrait of what does women's homelessness look like in Canada. So we did a big lit review, looked at a bunch of the statistics, and I just wanted to share some of the highlights from this work, just to get us all on the same page in terms of what did women's homelessness look like pre-COVID. Mm-hmm. And it's not a pretty picture, as you might imagine. Shelters in the VAW and violence against women sector and the homelessness system are so incredibly overwhelmed and underfunded. So, for example, between 2014 and 2015, emergency shelters across Canada, 90% of them are operating at capacity. You see here in Toronto, numbers from 2013 and 2019 operating at 99% occupancy rate. And we certainly know, and we'll talk about this later in terms of the restrictions on services because of COVID, and this is where we were at pre-COVID, right? And part of this issue is around funding. So here's a breakdown of shelter beds in Canada based on population. So you can see that only 13% are allocated to women. There's 38% that are general, so those can be co-ed shelters, but we certainly know that a lot of women identified folks and trans folks talk about being unsafe, feeling unsafe in co-ed shelters for a whole range of reasons. So there really is quite a small segment of emergency homeless shelters that are targeted to women. What's also, this chart's kind of big, but it's actually very important. One of the key things that we know is some of the areas where we have the highest need for women experiencing violence, experiencing housing precarity, we have very, very few shelter beds. So for example, on reserves in the north, 70% don't have any shelter beds for women who are fleeing violence. In some communities, and so these are when folks experience violence in those contexts, they either need to leave their community entirely, leave all of their social supports, leave their cultural connections in some cases. So this is a huge issue, and many of the communities that have the highest rates of violence actually have quite low availability of services. And then the third piece that we found, and this is really important, and I think this is a study I think about a lot, that Statistics Canada did, and I just applaud them for doing it, honestly. They did a snapshot day of domestic violence shelters across Canada, and they found that on this single day, about 1,000 women and accompanying children were turned away, largely because of capacity issues. So if you think about that, 1,000 people on a single day, what is the scale of that nationally, right? And very troubling, on that same day, they looked at, okay, there's women who are leaving VAW shelters, where are they going? On that day, they found that 21% were returning to live with abusive partners. 36% didn't know where they were gonna go, so there was not a plan in place. And 11% were transitioning into other domestic violence shelters. So, I mean, the bottom line here ultimately is that we have a system that is really overwhelmed, that is underfunded, that is not meeting the needs of some of the communities that are in most dire distress. And this is pre-COVID. And so my question to us in this discussion is, where does that put us now? What are the challenges that we're seeing across the country? And where are we seeing kind of an exacerbation of some of these issues? So we can kind of tackle this. Does anyone have any thoughts right off the gate?
Well, I just wanted to share, Kaitlin, in Manitoba and Winnipeg, we often have, and I shared this before, twice the national average
Yes.
in the rate of domestic violence. Yet, and I defer back, and I know it's not just about the 20, yet we don't have a 24/7 safe space. Since COVID, we've had 3 deaths as a result of police altercations. One was a 16-year-old girl. And on the very same day, and this happened within a 10-day span, a man was, ended up losing his life as a result of a domestic dispute. Those just since COVID, and those examples on the same day when we're talking about murdered and missing Indigenous women and girls, we lost another young girl, and it's a loss of life. And there's nowhere to go. And often our beds, as you say, there's not enough beds, but often there's a lot of populations, including women, girls, 2S LGBTQ+ peoples who just don't fit in the shelter system, who might not be fleeing violence for the night, but might be sexually exploited, who have no place to go to be safe, even just 24. It's a life and death matter. And I figure, and if the government can spend that much money, on corporate bailouts, mm-hmm. and protect offshore tax havens, there's the money right there to ensure the safety of women, girls, US LGBTQ+. I just want to leave it there, but it's a crisis. It's a life and death matter.
Absolutely.
And I would agree with that absolutely 100%. It is a matter of life or death. And one of the things we're hearing from our shelters across the country is that some of our shelters are experiencing a 20 to 30% increase, and they're asked to do more with less. Our YWCAs are stepping up and doing what they can to ensure physical distancing. So some of our YWCAs have started to work with neighboring organizations to see, can we actually get more shelter beds? Can we start to rent hotel rooms so we can actually create safe areas for the people we serve? I just want to talk about the experience of being a worker in the shelters and in providing services. It's really difficult. Just thinking about in Canada, there have been reported shortages of personal protective equipment. We're hearing a lot about that when it comes to the healthcare sector, but we can't ignore our essential services. We can't ignore our shelters. You know, we're happy to see that that type of conversation is starting to come up, but I really wanted to take this space to highlight that because that's something that we can't ignore because we're hearing about in different types of congregate settings, outbreaks of COVID. You know, for example, in Ontario and Quebec, there's been a lot of conversation about long-term care homes. We want to make sure shelters are not the next long-term care home. And I think first and foremost, it has to start with investing in our shelter system. So I want to say thank you for bringing up that point, Kaitlin. Something else I wanted to share is how all of these issues are interconnected. For us, we do a lot of work around housing and homelessness. We also do quite a bit of work around childcare, addressing gender-based violence, and also around the rights of workers and working conditions. And so when I just think about across the country, what women identified folks have had to deal with. They've had to deal with housing issues. 1 in 10 Canadian women in a report by Statistics Canada have said that they're fearful of violence in the home during this pandemic. So we're hearing about that. In March, 63% of the workers who lost their jobs were women. And so it's this triple, quadruple burden and this perfect storm. And then on top of that, adding the homelessness crisis, the lack of affordable housing across the country. And it's a recipe for disaster. And so I think when we think about Canada and what it needs to do, we can't have a piecemeal approach where you look at housing and you look at the working conditions and look at income security in silos. You have to look at it all together. And that's something that the YWCA has been pushing. But I really wanted to kind of just highlight the experiences of workers on the ground. It's been difficult. It's been very, very difficult.
Yeah, absolutely. And I feel like, yeah, I mean, it's been so wonderful and exciting to see the celebration of healthcare workers on the front line and the incredible work they're doing. And I really aspire to see that similar celebration of folks who are on the front line supporting folks who are underhoused, who are experiencing mental health issues on the streets. This is life-saving work. It's incredible. We need to be celebrating them as well. And yeah, it's just critical that you raise that, Anjum. Thank you. Leilani, maybe we'll turn to you and your thoughts.
Yeah, I mean, of course, Leah and Anjum have already said some really important things. I can just underscore, I guess, sometimes I take a kind of zoomed out approach just to sort of say, what's going on here? Like, how did we end up here? And in a lot of these conversations about COVID, I start with the World Health Organization because they were the first, of course, that's their role, to kind of come up with a prescription to deal with this deadly pandemic. And their prescription was to stay home and wash your hands and physical distance. And that's become the mantra of governments around the world: stay home, wash your hands, and physical distance. And I actually think that though that seems like a fairly neutral and life-saving prescription, it has discriminatory effects. And I think women are really bearing the brunt of those discriminatory effects, particularly women who may be experiencing violence newly or of yesteryear in their homes, as well as so many others. So just to say that, you know, when we have to always, it's amazing how vigilant we have to be. In the face of a global pandemic, I know it was urgent and it's so scary and oh my gosh, you know, so governments were racing to, and the World Health Organization racing to figure out what's the prescription. I understand that. At the same time, we can never lose the gender lens, the feminist analysis, the women's human rights analysis. And had that have been part of the WHO and all governments' approach and understanding, then staying home would have sounded different. It would have looked different. It wouldn't have been this like last minute, like, oh, the government's like, oh shit, homeless women, domestic violence, we better, you know, and then they're scrambling to come up with policies, you know. So in fact, we would have been prepared for a pandemic differently, and we wouldn't have had homelessness, and we would have it such a system such that women could leave violent relationships and have economic independence and autonomy. And I mean, there's so much there. It goes to Anjum's point about the interconnectedness of all of this. I just want to also highlight a few things about housing itself. I think there is this perfect storm, Anjum, you said it, you know, there's a perfect storm right now. But one of the things we forget about is that housing conditions themselves contribute to violence against women. And so it's not to take away from the perpetrators and to say, you know, not to take away from that analysis. Of course, there are issues there. But if you're living in overcrowded conditions, if you're living in decrepit conditions that are stressful, and then if you add to that job loss, which can also, or underemployment, or in the case of women, having to actually go out of the home and do the essential service, because it's like disproportionately women who are providing the essential services during this pandemic, it creates so much tension in the household, right? The stress can of poor housing conditions, of underemployment, of no money, of the stress of having to go out and deal with the pandemic and be susceptible to the pandemic, creates this kind of atmosphere that makes ripe domestic violence. So just to say that we have to look at housing as a contributor to domestic violence, in my opinion. And I wanted to say one other thing. Now it slipped my mind. I did want to just say something about what's happening internationally. I mean, it is off the charts internationally what's happening to women. So if you look at Western Europe, I'll just use that as an example. France has seen a 1/3 increase in domestic violence. All of the hotlines that are available are, you know, totally oversubscribed. There have been deaths, COVID-related domestic violence, deaths of women. I've heard in many circumstances of, this is a slightly different issue, but of landlords demanding sex from women who can't pay their rent. This is something we've seen before COVID, but you can imagine in the COVID time, the violence that's there as well. So, I mean, we're seeing this in every country. So very deeply disturbing. Sorry, I probably talked too long. My apologies.
No, never. Could listen for hours. So great. You're so refreshing. It's like, yay, you. Really. So, and I think certainly, I mean, I mentioned that the young girl, I mean, yesterday was an awareness day for murdered and missing Indigenous women and girls in Two-Spirit in the country. We are on the front lines of this issues. We experience the highest rate of violence in this country. We've had thousands and thousands of women either murdered or missing with little or no response. Here we are in the middle of COVID. We have yet to see real action from the current Canadian government to heed the calls to justice of the National Inquiry, including 4.7 for barrier-free 24/7 safe spaces where people can just go. I mean, you know, when you're in a situation where you're experiencing domestic violence, you might not be ready to leave. You might just need a place to go for the night for both you and your kids. You need a safe space. I mean, in addition to homelessness, you don't even have safe places to go. And it's a crisis in this country. And one of the things that I know when I approached you, there was a couple of tweets. One, you called tent cities a death camp. I thought that's a good name for it, right? Secondly, you called for you had 13 very clear guidelines, very reasonable, very clear guidelines on how to ensure people's safety during COVID. And third, you talked about opening up hotels to shelter, to house people that were experiencing issues around homelessness. We do have some supports now that are happening in the province of Manitoba, but these are life-saving measures. And this whole notion of social distancing, particularly for women, particularly for Indigenous women who experience higher levels of poverty, that's a really privileged discussion. Like, you need a house to socially distance. You need access to clean drinking water, something that many Indigenous communities don't have in remote communities. You need water to be able to do it. So I just found, although there's been some good action, the whole discussion around the pandemic, social distancing, I mean, it just became, for me, it felt like a middle-class love-in. And the most vulnerable populations, even now, are still not being resourced the way that they need to. And it is a life and death matter. And I think certainly my riding, our city, exemplifies the need for immediate actions. And just one last point, like, it's not that the pandemic doesn't cause crisis, but the reality is the only reason we are in a crisis is because of willful human rights violations that have gone on in this country. If people had housing, if people had access to clean drinking water, a guaranteed annual livable income, we wouldn't be scrambling right now. People would have what they need. So I'm hoping we learn from this through action. I'm hoping that governments choose not to go back to austerity, but make sure that diverse communities, women, girls, QS, LGBTQ+ people, for example, who still lack resources, are provided the supports that we need to be safe going forward.
Absolutely.
I wanted to say something. Can I say something? Sorry, I've only done a few of these with. Is that okay?
We're hoping that we could keep the questions until the end, if that works for you. We have a few that we're going to move through first and then circle back with the larger community. Awesome. Thank you. Perfect.
Kaitlin, can I just jump in to say, and I'm sorry, Cody, just to say, I think there's so much discrimination at the root of what's happening. Even if I just look narrowly at COVID, like the issue that you brought up before, Anjum and Kaitlin, around celebrating the frontline workers, the social workers who are working with homeless populations and who without PPE and who haven't been given PPE and all. Well, I'm sorry, but the whole area of homelessness and people living in homelessness, that is a discriminated against population, period. And the people who work with them also just, healthcare, nurses and doctors have a completely different status in our society, in my opinion, than do. When we think about people going to hospital and being treated by nurses and doctors for COVID, we are not thinking about homeless populations. We're thinking about, it's exactly what Leah said. We are in this middle-class nightmare narrative. I really feel that. And so we need to somehow pivot the narrative. We need to be louder, I think, about all of the people getting lost in this COVID rollout. I feel it so strongly. I mean, how could we not give PPE to social workers working in congregate settings? How could we do that? Yes. I mean, I think the government.
And I absolutely agree with you. And I think part of it comes from, so I didn't mention this before, but I come from a public health background. So I actually, was working in that space before I came into the work that I do. And I think part of it is we've been talking a lot about public health guidance, but we haven't been centering the communities that are most affected. Like right away, both of you pointed out who can actually have the luxury of doing physical distancing, who has a home to actually do that, right? And who actually has a place that is not overcrowded, et cetera. It is a very privileged conversation. And I think one of the missed opportunities here, and where I see as hopefully moving forward, is we need to start to look at the health and well-being of our society from a more holistic perspective. It can't just be about healthcare, because that's not actually preventing the issue. When you look at housing and homelessness, that is one of the biggest determinants of health and well-being. So is income. Leah, you mentioned about basic income, for example. All of these things contribute to the social fabric of our society and also the type of healthy society we want. So my hope would be, when we're thinking about where we want to go in the recovery, so much of our response has been very public health focused. I'd like to see social determinants of health play a critical role in being the roadmap for recovery. And that means investments in housing. That means investments in decent working conditions for all. That means childcare for us, right, as well, and putting that at the core. When I think about all the expenses that disproportionately women have to bear, we need to do a complete recalculation about how we structure our society and what we prioritize. And for me, what I'd like to see, and we haven't seen enough of this, is a feminist economic recovery plan, putting women and non-binary folks at the center of this conversation, because we can't talk about recovery without the people who are doing the essential work.
Yeah, agreed. It was interesting. I was having a conversation yesterday morning with a colleague of mine, Emily Parody, who's a brilliant thinker. And she was saying, you know, we're in this moment where we're doing really rapid policy development. And it seems that consultation and with folks experiencing homelessness has kind of gone out the window. You know, there's been this need or this desire to really rapidly create solutions, but the kind of consensus building and leadership that we need from folks who are actually living this has not necessarily been facilitated by the ways in which we're doing this. And so, like, I'm wondering here if you folks have some thoughts on, you know, what have government response, where have been the successes and where have been the shortcomings of, well, we've discussed some of them, but of government interventions around COVID with respect to women in general and women who are struggling with housing issues.
I think
one thing.
Sorry, go ahead. Did you want to go first? We're just like chewing out the bit.
This is great. Like, I love this. No, go ahead. And I will talk after. No worries.
Women. I do want to say this. I think we have to remember the premise on which this country was founded. And it was founded on the wrongful dispossession of lands from Indigenous people. It dispossessed women, particularly Indigenous women, of their roles in community. And this was legislated in the Indian Act, an Indian Act where myself as an Indigenous woman is still, never mind other women, or never mind men, I'm not even equal to other women in this country. And I think we see the rates of violence you know, affecting all women, but certainly at a much higher rate, Indigenous women and girls. And if you look at the government's response, and I had an opportunity to ask these questions in committee, you know, Indigenous people just on a whole, we comprise about 5% of the Canadian population, yet we're only receiving 0.01% of the funding. How do you come up with those calculations when Dr. Tam, the Chief Health Officer, has indicated that we are at a greater risk, Indigenous people, because of ongoing under-resourced health for all peoples, you know, and that includes shelters. The amount of money that was put forward for shelters certainly doesn't reflect the rates of violence in this country. And I mean, they're you know, aware of this. And I think that we have to call this out. If we're going to move forward as a country, I hear words like reconciliation, then we have to really point out some of the willful and intentional discrimination that still occurs in this country. And we have to change that behavior. And I just wanted to point that out. I think that's a really soft spot for me. And it's certainly in my riding, I have a large number of newcomer and refugee women coming, moving into the center, and we just got cutbacks to organization. Where are women supposed to go who are experiencing violence? I think we need to look at that, and I think we need to look at how government spends money, what the priority is, And we need to do things differently. It needs to be people first, and we have to stop funding this growing corporate dictatorship and use that money and invest in people. And then we wouldn't be in this crisis. It's actually about choices. So yeah, it's like a healing. I'll pass it on to you, but oh, that felt good.
Agree 100%. Yeah. Yeah, and I think just picking up on your point, I think we have to be very clear. Austerity kills. Cutting back services kills, and not just in a figurative sense. Like, it actually impacts the mortality and morbidity of the communities that we're part of. So we have to really question those choices, because who are we doing cost savings for? Who will benefit from those choices, right? I think there's also this rhetoric right now around, let's use this pandemic to build back better. And I agree with that. But I think also many of the solutions to the situation we're in were already talked about for decades. Communities, Black, Indigenous, racialized communities, migrant communities, people with disabilities, the Two-Spirit LGBTQ plus community, they've been telling us what to do. We just have not listened. And that's why we're in the situation we're in right now. So I would say, instead of us thinking about a new blueprint, let's go back to what communities have been saying for decades, centuries even. And I think, yeah, I 100% agree. This pandemic, in many ways, we talk a lot about pandemic preparedness and, how do we prepare for these types of crises? It starts with actually investing in our public services and our social safety net and our people. So I think we know, like, today's conversation is about housing, and that's part of that. That is part of the social safety net that protects people in times of crisis, but also ensures that they can thrive. We don't want people to just survive day in, day out. We want people to reach their full potential. And I think housing, for me, it starts at home, right? So that needs to be step one of what we do after this pandemic and during this pandemic as well.
Yeah, beautiful. Leilani, I'm not sure if you want to jump in, but I was thinking we could possibly turn to what does kind of a post-pandemic world look like in terms of justice and equity for these groups that we're talking about. So, what are you folks thinking about as a vision moving forward, and kind of what gives you hope, what gets you excited about, the months and years to come, in terms of the possibilities that might be emerging because of this moment?
I wanted to, I'll jump in if no one minds, because my comments for the last question actually do go to your new question, Kaitlin. So I think it works. I think it works. I really liked what you said, Leah. I mean, here we have billions of dollars being spent to address COVID and its fallout. And I learned, I think it was yesterday night or 2 days ago, I learned that a very large private equity firm named BlackRock has been advising our government as to how it can structure its economic stimulus, etc. Now, I can rest assured BlackRock does not have human rights of women at the forefront of their mind. They don't have it, in fact, anywhere in their analysis. And I really feel we need to demand of the government a human rights oversight body to, or advisory body, not advisory, I think oversight is the right word, that has the power to hold the government accountable to its human rights obligations for Indigenous women, racialized women, poor women, homeless women, as well as other populations, vulnerable populations, whose rights are most at stake. And I really feel strongly, I don't know of any jurisdiction that has done this. I have to admit that, across the world. But I really feel it's absolutely necessary. It is where governments went wrong. Well, not went wrong, but in 2008, after the global financial crisis, no oversight bodies were set up, human rights oversight bodies. And as a result, the banks were bailed out, corporations were stable, and the people who already suffered the global financial crisis suffered more. And that cannot happen as we move forward. Cody had put in the chat, and her question, the question was something about, some people have been granted hotels. What's going to happen post-pandemic? And that goes to your question too, Kaitlin. I just want to just say a little thing about that. First of all, I will not applaud the government for spending money to house women in shelters, or to house people in hotels, or to house people in longer term housing. I will not applaud them for doing that during the pandemic, because that is simply their human rights obligation. And it was their human rights obligation, as Anjum said, before the pandemic, and it is their human rights obligation during the pandemic, and it is their human rights obligation after the pandemic. And so I will not applaud them. I will say that it is a requirement that governments ensure access to long-term, stable, affordable, secure, and safe housing for everyone, particularly women, LGBTQ, two-spirited, etc., Indigenous women in particular, who suffer so much across the board on every front, socioeconomic disadvantage, every front. So in terms of hopes for the future, I'm not like that. I'm not like that. But I feel strongly that we need to hold our government accountable to their human rights obligations that existed before and during and post pandemic.
Beautiful. Thank you, Leilani. Leah and Anjum, do you have thoughts that you want to add about kind of how you're imagining a post-pandemic world and what justice and equity looks like?
Well, I think, if anything, COVID-19 has done, it's shone a light on the gross inequalities and inequities in this country. And I hope some of it's addressed, particularly around homelessness, particularly around gender-based violence, looking at ways where we can look after people better. And I'm really hoping, I know it's not going to be, everything's going to be roses after this is over, but at the very least, if this government has not learned that a guaranteed annual livable income is necessary, we're in big trouble. If this government doesn't get the fact that providing people with a safe home is a life-saving measure, not just for the person experiencing homelessness, but for the whole community, then we're in big trouble. And I think whatever happens, I've often spoken about the importance of people power. I think now is the most critical time for people to really work together to hold government to account. One of my biggest concerns coming out of this is that governments will try and move back to very, very strict, serious austerity measures that will put people further in crisis than they were before the pandemic. We must not let that happen. And I think the only way that will happen is if we hold the government to account now and post.
Yeah, absolutely. And it's amazing. What we've seen around the globe in terms of policy that, politicians have laughed at in the past is suddenly on the table again, right? So Spain is introducing a universal basic income indefinitely. London, England, politicians have been saying for years, rough sleeping is an intractable issue. There's no solution to it. And then over the course of a weekend, essentially move huge numbers of folks who are living on the streets into hotels and motels. The Yukon, for example, is there's cell phone companies that are providing free phones and data to women experiencing violence, experiencing homelessness, and they're not going bankrupt. All of these things were possible before, they're possible now, and they're possible in the future. So I think part of it is a huge piece of it is the political will piece and our ability to build and create momentum and people power around this, but then also kind of our own struggles internally to, in our own imagination, to conquer the frameworks that we live with, even as someone who's like been committed to ending homelessness for, you know, my whole adult life, thinking about, are we actually going to do this? Like, I have to get over my own mental frameworks I've had around what is possible and isn't. This is the time for like such big dreaming, I think.
Yeah, and on that note, I am optimistic in terms of where the future lies. I think the changes we've seen in the last 30, 40 days, some folks have been telling me that was unimaginable 30 years ago. So I think part of it is exactly what you're saying around political will. So I think part of it is also people are waking up. I see this moment, I'm hoping, and I'm going to bet on it, is that this is the moment that politicizes incredible proportions of the Canadian population, that what we say matters, collective action matters, people power matters. And if I were to say a policy prescription or things for us to think about, one is centering the communities most affected. We need to ensure it is not people that were already doing well before this crisis that are informing the policy solutions, is the people that are most impacted by this crisis, first and foremost. Two, I think one of the things that gives me hope is what I'm starting to see actually happen south of the border in the state of Hawaii. Their Status of Women Commission actually published earlier in April a feminist economic recovery plan. And that is something that they are utilizing to start to inform public policy. Why do we say Canada is actually working on our take on a feminist economic recovery plan and sharing that as an offering to the broader civil society community later this month? But it's to start a conversation, because I think that we can't ignore that we need to do things differently. And I think a feminist analysis, a human rights analysis, a gendered analysis is what's going to get us through this crisis. And finally, when I think about, there's 10 million millennials across the country, close to 27-30% of the population, if not more. And so I've seen them also thinking about this, the choices made now are going to be the choices we have to live with. So can we use this as a moment to propel us to action? So that also gives me hope, but I think hope cannot be enough. It needs to be coupled with action. And I'm looking forward to working with everyone here on that action.
Hear, hear. And here's some political will here.
Yes.
Let's cause some trouble. Yay! Smash it down.
Leilani, do you have any thoughts about what is making you feel hopeful moving forward in these struggles?
I think Anjum you were so articulate. That was just a beautiful way to address that question. I probably, as I said, I'm not one, like, it's just not how I'm configured, where I think about what makes me hopeful or whatever. I just kind of keep going and just do my work. And I feel, I think a lot of what you said is right. I love this idea that this is a political awakening this will be a political awakening for so many people. I really hope, there's my hope. I hope that that's correct. And I think there are the possible ingredients. I suppose what worries me is that people are so freaked out about the actual virus itself that when we get the kind of all clear, I worry that people will just resume their lives so desperate for normalcy, and forget about what we've learned, what we're learning on a minute by minute, day by day basis. So I hope that we can counter that and keep up the narrative that you talked about, Anjum, because it's so, it's super important that this is a huge historical moment.
Yes.
In such a big way, and we should be learning. We should always be learning from these moments. So, but unfortunately, my sense is that we have not actually seen any structural change. I don't see structural change, because what I hear politicians saying is, yes, we're doing this because there's an emergency. This is an emergency, and this is an emergency measure. And rather than saying, you know, we kind of fucked up before the pandemic and we didn't meet any of our international human rights obligations. And so now we're going to right the wrong and we're making structural change so that the future is better for everyone. I love this idea. Someone said, I think, I don't know which one, but said, you know, we should emerge from this whole. And I'm not hearing that from government. So we need to push them on that.
Yeah, agreed. Yeah, absolutely. We just have a couple of minutes left. So I'm sure there's lots of brilliant thoughts and questions in the chat that unfortunately we're not going to be able to get to. But maybe I'll turn it over to any of our panelists who have any final words for attendees, any encouragement, excitement, next steps, anything you want to add?
Well, I just want to thank, I know you just finished 6 years and you're on to the next, but for your tremendous contribution and your tremendous work. You know, to everybody on the panel, I look forward to working with you to push this forward. It is critical, and we can't go back to normal that was so socially not normal and inhumane. We have to figure out a way forward, and I'm all for we need to mobilize, and I do feel hopeful. It's about fighting for the right to joy that keeps me going. We've got to fight for joy for everybody and ensure everybody has what they need, the dignity that they need to have joy. And just like was said, just stay focused. And millennials, I wish I was a millennial. They get it like nobody else.
Yeah.
And that makes me know that we're in good hands in terms of pushing things forward. So thanks everybody, and thanks to everybody who organized it, who's behind blank screens on the screen. I know this was a big effort. It's been such an honor. I can't wait to work with you even more to advance this.
Yeah. Okay, thank you all so much. That was a beautiful place to end. I hope you all have a beautiful evening. This recording will be up on YouTube, so feel free to share it with all of your friends and community members, and please stay safe.
Thank you. Thanks, Leah.
Thank you so
Bye,
much.
Anjum.
Bye, everyone.
Thank you, Kaitlin. Amazing chairing,
Bye, Leah.
Kaitlin. Thanks.
Thank you, Caitlin.
Thank you.
Bye.
Bye, everyone.
Thanks. Bye.